misinformation concerning the $90 million deficit to the Medicaid program and the role that hospitals played in that $90 million. It's been stated by numerous officials that the hospitals in the past paid the $90 million and that they should continue, that was stopped in 2005, and that now all they're asking is that the hospitals reinstate and pay the $90 million. That, in fact, is not the case. The hospitals never paid $90 million. What we had was and the program that we designed was an intergovernmental transfer program. That's where there were 28 publicly owned hospitals owned by counties or municipalities. They gave the state Medicaid program 72 cents. The Medicaid program took that 72 cents and drew down the federal dollars matching for it. Those hospitals were then paid the 72 cents back plus 28 cents. So for every 72 cents they put up, they received $1 back in enhanced, or excuse me, in being reimbursed by the Division of Medicaid. So to state that the hospitals and the association designed a taxing model is totally incorrect. It was an intergovernmental transfer program. In addition to that, there's been statements made that the hospitals get a 6-to-1 return for every dollar that they put up. Again, that is incorrect. The hospitals do not receive the money. The Division of Medicaid and the state has that money that they in turn make claims payments throughout the Medicaid program. If you look at the Medicaid's own cost figures and their own material, you will see that Medicaid underpays hospitals for the cost of care of Medicaid patients by 83 cents on the dollar. So 17 cents on the dollar of cost of providing care to the Medicaid recipient by the hospitals, that 17 cents is having to be passed on to the private paid patients that come into the hospitals. With the current economic condition that everyone is facing, the current economic condition that our hospitals are faced with, when you look at 50 of our hospitals in the state prior to this economic crisis was that's 43% of the hospitals in the state, they are operating at a zero or minus margin. That means they have no profit, that they are in fact losing money. For the state to come in now and say that we want to put a $90 million new tax on hospitals, in our opinion, is unfair. It will lead to a reduction in services. It will lead to a reduction in the staff